Today we're going to discuss a scary thing, but it's not so scary. It's called macular degeneration. Other than cancer and heart disease, what does everybody not want to have? Macular degeneration. So what is this thing called macular degeneration? Well, we know it can cause blindness, we know it can be progressive, and we know that we want to persist on trying to minimize our risks. I argue you want to take a proactive stance. Don't wait until you're diagnosed with macular degeneration. You want to do it up front. However, if you are diagnosed with MACD, you really want to go ahead and take charge by doing everything your medical doctor tells you, or your ophthalmologist, your eye doctor, but also do some things proactively. So macular degeneration can be kind of put in a simple term: central vision loss. Central vision loss is when I look directly at you, I'm seeing you with my macula and part of that eye. However, it's not the peripheral vision like over here, the periphery. It's actually degeneration of the central part of your eye. And you really want to take charge of preventing that from occurring, because if that does occur, you actually lose that central acuity, or that ability to see clearly. And so the world becomes smaller and smaller and smaller until you literally sometimes you can only see through a pinhole, and you don't want that to occur. Legal blindness has risen in the United States, and if you're over the age of 55, your risk, of course, increases dramatically, and macular degeneration is the leading cause of this blindness over the people that are 55 or above. Age-related macular degeneration affects 1.75 million people. 1.75 million people, almost 2 million people in the U.S. have macular degeneration. There's two types, and that's important to understand. There's a dry type, which most people start with, and then the dry type can go into what's called a wet type. The dry type is called atrophic. So just like your skin becomes dry and wrinkled, other tissues become dried and wrinkled. Likewise, your macula can actually become dried. Due to gradual breakdown of the cells in the macula, part of your eye, and small, round, yellowish spots can start occurring, can be seen as early as the age of 30, and sometimes even earlier. And there's little drusen, D-R-U-S-E-N, accumulations which are occurring, and as a result, this slowly but surely starts causing a loss of your vision. So dry form usually is the way it starts, but it can go into the wet form. And the wet form is where there's excess blood vessels now in your eye and other exudate or material, which is actually clamping down and acting as a fog over your visual central acuity. So now all of a sudden it's like having a whole lot of obstacles between you and me. It's hard to see, leading to leaky blood vessels. Leaky blood vessels further cause problems, destroying your central vision. So let's talk about blood vessels. So we can have hemorrhoids, we can have varicose veins, we can have ruptured blood vessels, but it all comes down to integrity of connective tissue. So you want to have things that support connective tissue like vitamin C. You want to have bioflavonoids. You want to make sure you have a diet rich in good, healthy proteins, because once again, you can't build strong bodies or strong body tissues without, of course, enough protein, enough connective tissues. So vitamin C is top of our list for people with macular degeneration. If you look at the monkeys in the zoo, not calling human beings monkeys, we're definitely different, but for those people that want to make a comparison of similar physiology creatures, monkeys get fed some 4,000 to 6,000 milligrams of vitamin C a day. Our recommended daily allowance is 60 milligrams per day. That's to prevent a condition called scurvy, bleeding gums, breaking down tissues. If you want to really crank it up, and unless you have a history of kidney stones, doing a couple thousand milligrams a day with, of course, your doctor's supervision would be a good recommendation, because it helps with stronger connective tissue, a cross-meshed connective tissue. You don't want to have leaky blood vessels anywhere in your body. Likewise, you don't want to have not enough antioxidants. Vitamin C is a phenomenal antioxidant, helps with connective tissue. Vitamin E and A, not only antioxidants, but vitamin A helps with connective tissue and skin. And when remembering whether it be the skin on the outside of your body, skin on the inside of your mouth, skin elsewhere throughout your body, your GI tract, you have to have vitamin A for what's called epithelialization, or the creation of healthy skin. Of course, we also know that vitamin A is retinol, and retinol levels should be measured in your blood. If your blood levels of retinol or vitamin A are low, you're going to want to crank it up. If they're in the middle of the range, you're going to still probably want to crank it up, realizing that too much vitamin A can be toxic to your liver. So once again, measuring liver enzymes and making sure you don't go too high. More is not better in the case of vitamin A. 10,000 international units, pretty common. Some people go a little higher. And once again, working with your doctor is important. Beta-carotene also critical, and mixed carotenoids. So just like we eat a carrot, we don't just consume a carrot and think, oh, I've got beta-carotene. You're going to get a lot of other nutrients in that carrot. You're going to get mixed carotenoids, alpha-carotene, beta, gamma carotenoids, and luteins. And lutein is very important for macular degeneration. If I had one piece of advice for everybody 30 years of age or older, take 6 to 20 milligrams of lutein per day. That's all you did. Said, I'm going to take lutein on a daily basis. Not only can it help with cataracts, but it can also help with macular degeneration. Quite a bit of research on that. So once again, consider lutein on a daily basis for all of us. Let alone if you have a family history of eye problems, definitely a no-brainer. But for all of us, why wait until we have a problem? I like seeing things, you like seeing things, and it's not too late to start your lutein even if you have macular degeneration. You want to take charge. Also CoQ10, ginkgo, bilberry, quercetin, and bioflavonoids. So if you have hemorrhoids, if you have varicose veins, if you have other vascular bleeding issues, once again, bioflavonoids are important. Vitamin C is important because it all comes down to integrity of your vasculature. Your blood vessels in your eye are important. In fact, they say the eye is the window into a person's soul. Medically, it's also a window into your nerves and into your blood vessels. Nowhere else in your body can you actually directly, without anything between, visualize your nerves and your blood vessels. So when your doctor looks in your eye, or better yet, when you go to your eye doctor on an annual basis, he or she will look in your eye. Often they'll dilate, which is good because they actually can get lots of light and see in there. They actually will see, how are your blood vessels doing? Because they actually will be looking at your blood vessels. Likewise, they'll be looking at your nerve to see how is that optic nerve, how is the macula, how is the retina doing. Let them look, because indeed it'll let us see how healthy you are from the inside out. So look at your eye as a window, not only into how your eyes are doing, but how other things are doing. People with diabetes, people with high blood pressure, also get conditions called retinopathy. Once again, that retina is where you're seeing things, and you want to be looking at taking care of that. So with macular degeneration, remember, lutein, bioflavonoids, vitamin C, working with your doctor, and everybody needs to go in from the age of 30 onwards to get looked at to see how are their eyes doing. What an investment to be able to see the world for a lifetime. So take charge, persevere, make time in your life to take care of your body, because your body's taking care of you on a daily basis.